Hi, everybody. My name is Gemma Delgadio. I'm the Director of Marketing at Perfect Teeth. And guess who we have today? We have a specialist in the house. We have Dr. Judd. We are so excited. We are at the Perfect Teeth 88th and Wadsworth location today, where Dr. Judd practices. He is a specialist in his field. He's an orthodontist. We have some cool questions for you today, Dr. Judd. But we want to know, why did you choose ortho? Why not general, and why not kids? I mean, why not pediatrics? Why did you choose braces?
Well, when I was a teenager, I had some crooked teeth, and like many people out there, I went to the orthodontist and had my teeth straightened, and it just boosted my confidence. And I can't think of anything more fun to do than to put smiles on kids' faces. I like to make kids laugh too, so it all kind of comes together.
So you have some jokes, right, Dr. Judd? We'll hear some of those later. So how do I know if my child needs ortho treatment? And we're going to talk loosely here when we say ortho treatment. You know, I know that you're an Invisalign consultant as well, and you practice with Invisalign as well as traditional braces. But how do we know if children need orthodontic treatment? What are the early signs?
So some early signs, if we're kind of talking about 7-8-year-olds, is that their teeth might kind of stick out. They may have had a thumb sucking habit when they were younger. That's something that I look for. I also look for crowding. You may be looking, why are my kids' teeth not coming in as quickly as their friends? That's something that I also take a look at. One of the other things I also look at are cross bites, which essentially is, does my kid have an underbite? Do they look like they have a very narrow palate? And so those are all things that I look at when kids are a little bit younger. Obviously, when they're teenagers, we're looking at everything. We're looking at all the things I just previously mentioned, but also how do the teeth look? Are they crowded? Are there things that I can do right now to kind of improve their smile?
So, Dr. Judd, that's a good answer, actually, because I was going to lead into, I had braces. We were just talking right now that I had braces as a child, and I enjoyed them, but I was in them for a long time, and I had to have a lot of teeth extracted. Now, is it required that children or adults, when they go into braces, when they're looking to straighten their teeth, get teeth extractions? Is that something that's required?
Absolutely not. We extract teeth only if it's necessary. The three things that I really look for if I need to extract teeth on someone when they're a little bit older is the amount of crowding that they have. I look at the face to see if extractions of teeth would improve the aesthetics of the face. Are the lips pushed out, protruded? And then I also look at the proclination of the teeth. Are the teeth pushed out? So those are my three things that I look at in particular as to whether or not I extract teeth. I try not to extract teeth. I try to keep the teeth if I can. And that's why it's important to come and see your orthodontist a little bit sooner when they're 7 or 8 years old, because I can do something like an expander where I can create more room so those teeth, as they're kind of coming in, they have a parking spot where they can actually come in.
I love that, a parking spot. That's pretty neat. I haven't heard that before. So, Dr. Judd, we see more and more adults having better dental and physical health right now, and they deserve to have and enjoy a really beautiful smile. So is age a factor when we're considering Invisalign braces? We know that between the ages of around 7 and 13 is typical of when we like to see somebody come in for, guess what, you guys, a free consultation with Dr. Judd. Free consultation. Yes, I said that. But we know that age is not a factor when it comes to braces. Tell us about that.
You're absolutely right. I have a patient at another one of my offices who's in Invisalign. It's close to 70 or 80 years old. So age is definitely not a factor when it comes to if you want braces or not.
Great answer. I love that. So orthodontic treatment, we know, has improved dramatically over the years, and you're the expert. You've seen this firsthand. So we use the latest technology, braces, and when it comes to the orthodontic treatment, is it painful? Let's just get down to the facts here, Dr. Judd. Is it painful?
My goal is to make it not painful. Typically, with orthodontic treatment, you're just going to be a little sore. Someone just mentioned to me that it's kind of like when you go to the gym, you'll be a little sore afterwards, and that's kind of what we're talking about. But in order to get that beautiful or handsome smile, you'll be a little sore, but you'll be pleasantly surprised by the end result and love your smile.
Great. Phew. Okay, I'm not scared anymore. So we were talking this morning about phase 1 and phase 2 of treatment. Now, not everybody knows what this means, what these two phases mean. Can you elaborate on these two phases, phase 1 and phase 2 of treatment? And last question of this section is, does everybody need phase 1?
So to get to that last question, no, not everyone needs phase 1 treatment. When I look at someone and they're 7 or 8 years old, what I look for phase 1 treatment are cross bites and crowding. Do your teeth stick out? Is there something that I can do to make it so that they don't stick out? Are you going to have a lot of crowding in the future? And can I do an expander or something along those lines to create more room so that your teeth do have that parking spot so that they can kind of come in? And we want to get rid of cross bites when you're younger as well, because you can start to wear down your permanent teeth. And so that's why we look at kids when they're a little bit younger for phase 1 treatment. Phase 2 treatment, someone comes in, we look at everything as I mentioned before, cross bites, crowding, the look of the smile, everything along those lines. So phase 1 treatment is only something that I do if I feel like it's going to be a benefit. If we do a very successful phase 1 treatment, we can sometimes avoid extractions in the future, and we can also make your phase 2 treatment a lot not as long of a treatment. You mentioned that you had treatment for 3-4 years. You might have benefited from a phase 1 treatment where I could have made it so that you would only be in braces for 15 to 18 months.
Well, maybe I'll consider getting braces again. How about that? Possibly. Yes. So last thing, Dr. Judd, we've been speaking about something very, very exciting this morning, and it's called Smile Snap. Now, this is coming down the pipeline for our orthodontist here at 88th and Wadsworth, and in our Loveland location at Centera. It's a virtual consultation with your orthodontist. Now, this doesn't seem real. This doesn't seem like this could be happening. It's happening. So you don't even have to come in to your dental office to have a consultation. Now, Smile Snap is a widget which is embedded into your website, and this allows patients to answer questions. They upload images of their mouth, their teeth, their profile, and submit them to Dr. Judd. He then analyzes them, looks through, and provides you with a cost and how long you will be in braces. Now, surely this cannot be true. So it's a virtual consultation with you. Tell us a little bit about this.
Yeah, it's great. So you just follow the widget. It's going to take you through some instructions, ask you what your primary goals of treatment are. It'll ask you for some photos. You don't have to be the best photographer. Just take the best photos that you can. Once you submit all that, I'll get a little ping on my phone, actually, that tells me, hey, so-and-so just uploaded some photos. Take a look. Hopefully my wife won't hate me too much, because I'll probably jump right at the opportunity to take. I look at teeth all day, so I like looking at teeth. But I'll take a look. I'll give a ballpark estimate as to how long your treatment will be and cost as well. And then to kind of give you the full rundown, we'll likely have you come in for an appointment and kind of go from there.
So this is a real-time consultation, you guys, and nobody else is doing this. This is exclusive. This is very, very important to our office. And as Dr. Judd said, this is real-time. This is him responding to you. So please take advantage of this, which is coming soon to our dental offices. Thank you so much, Dr. Judd, for spending some time with us today and taking time out of your busy, busy schedule with your wonderful patients to talk with us. Again, Dr. Judd is located today and throughout the week at the Perfect Teeth location at 88th and Wadsworth and the Centura location in Loveland. We will always welcome new patients. And again, there's a free consultation with Dr. Judd that is waiting for you. So thank you again. And we look forward to spending more time with Dr. Judd in the coming months when Smile Snap is available. Thank you so much.